All right, let's talk about anatomical terminology. So this is being covered in both lecture and lab because it's really important to understand the basics of how we talk about the human body and the anatomy of the human body. So we're going to talk about anatomical position, different directional and regional terms. We're going to talk about some planes, that should say planes, not plans, that are really commonly used in the study of anatomy, and then we're going to talk about some different body cavities and their subdivisions, and a little bit about which organs are found in each of those subdivisions. And then we're going to talk a little bit about serous membranes and what their function is. So anatomical terminology is really important because we need a common way to talk about the human body in both research and the medical field and in a classroom. And this is because, if somebody's standing in front of a person, then their right and left may not be the same as somebody who's standing behind the person. So how do you know what's actually accurate if you don't have some sort of common language and terms that you are using to refer to different areas of the body or different structures within the body? And so anatomical terminology was developed because it helps make things a lot more precise and helps reduce a lot of medical errors because everybody knows what is being discussed, everybody has that common reference point, and then we have much more accurate descriptions of where things are located. So most of the terms that we use have roots, prefixes, and suffixes. A lot of anatomical terminology is Latin-based, and so you'll see a lot of Latin-based words pop up here. So some of you maybe have taken medical terminology before and will recognize a lot of these, but you do not have to have taken medical terminology before this to still do well with anatomical terminology. So a root is usually going to refer to an organ, tissue, or condition. Prefixes and suffixes, so beginning or end of the word, these are going to describe the root. So for example, hypertension. So the prefix here is hyper, meaning high or over, so something above what is considered to be normal or average. And then the root of this word is tension, and in this case that's referring to pressure, so how much pressure or strain is being put on a certain structure. So hypertension is the medical term for high blood pressure because there's a lot of pressure being put on the blood vessels, and this is higher than hyper to what is considered to be normal and healthy. So anatomical position is a standardized way that anatomists and medical professionals are going to view the body. This gives everybody a common base point in which to reference everything else in the body. So anatomical position, we'll see a graphic of this on the next slide, but this is where the body is standing upright. Feet are roughly shoulder width apart and they are parallel with the toes facing forward. Upper limbs, so the arms, are held at each side with the palms of the hands facing forward. And that's not a natural position for people to stand in. Usually our palms are facing backwards or in towards your sides, your legs, or your hips. But in anatomical position, we are specifically having those palms facing forward because that's actually what puts the bones of the forearm, the ulna and radius, lined up side by side next to each other rather than crossed, which is the position they're in when you're standing naturally. And then last but not least, the face is looking straight ahead in anatomical position. So everything else, all of our directional terms specifically, are in reference to anatomical position because, again, this gives everybody talking about different areas and structures within the body a common base point to start at. So everybody knows what that starting point is and therefore what each of those directions are in reference to this base point. So we will talk a little bit about these next two terms, prone and supine. So again, the body is going to be in anatomical position, but if the body is laying face down, it is said to be in the prone position. And if it is laying face up, that is said to be in the supine position. All right, so you will see those terms come up a couple of times here and there. So here in this graphic, we can see a body in anatomical position. So feet are facing forward, they're roughly shoulder width apart. The arms are at the sides with the palms facing forward. So as you can see, this is not, again, how we naturally stand as humans, but this is what anatomical position is because of that orientation of the bones in the forearm. All right. So what we're going to talk about here is different regions of the human body. I'm not going to go over every single one of these in this particular lecture because we are going to talk about most of these, but not all of them in lab. But you do want to memorize this and be able to refer to it for the rest of the semester because there are a lot of things in the body like blood vessels and nerves that are named in reference to what region of the body they're in. So for example, let's come over here to the left-hand side of the screen, the axilla or axillary region, which is the armpit area. So that is the region of the body, and then when we get to blood vessels later on in the semester, you will find that we have an axillary artery and an axillary vein. So we've got those two vessels that run through the armpit area of the body, and so knowing what region of the body it is can help you out a lot before we even talk about these blood vessels in knowing what their name possibly is. And so one other thing I want to point out here is a lot of these terms that are listed here in the textbook that are bolded, they are very similar to but do not perfectly match what's in your lab manual. What better matches what's in the lab manual are the terms below them or next to them that are in parentheses. Generally speaking, I will accept either because I know that our lab manual and our textbook do not match, and I am expecting that a lot of people are going to be using both of those things. All right, so again, we're not doing all of the regions in lab, but you should still have a decent idea of a lot of these. So like the buccal area or bucca, that's the cheek area, that's something that we will not be covering in lab, whereas cervical or the neck region, that is something that we will be covering in lab. All right, and so you can see that each region of the body has its own unique name. The thorax or thoracic cavity, which refers to the chest area. We have the abdominal cavity down here, pelvic cavity further down, the umbilical region or umbilicis, and then for the arm, we've got the, again, axillary region in the armpit, the brachial or brachium region, which is the upper arm, antebrachium or antebrachial region is the forearm, and then in between there, the region of your elbow, the front of the elbow, actually has its own special name, as does the back side of the elbow. So the front side of the elbow is the antecubital region, whereas coming over here to this picture on the right, the back side of the elbow is referred to as the olecranon region. And that'll make a little bit more sense when we go over the structures within the ulna and radius. One of them actually has the olecranon process that is going to be located there at the back of the elbow. All right. And so a couple others I want to take a moment to point out a little bit. The knee is very similar to the elbow, where the front of the knee has one name, which is the patellar region, because we have the patella bone at the front of the knee, whereas the back side of the knee is the popliteal region. That's always been one of my favorite terms to say, is popliteal. I think it's so much fun. You gotta find fun where you can in anatomy, because a lot of it can be a little bit dry unless you make it fun. All right, so that is regions of the body. And again, this is just helping to give all researchers and medical professionals a common way of talking about the human body so that everybody knows exactly what is being discussed, so we have that precision and there's no confusion. All right, let's talk about directional terms. Okay, and this is where knowing anatomical position is really, really, really important, because all of these directional terms are in reference to anatomical position. So you can see our graphic here shows this model in anatomical position. So all of these directions are going to be in reference to proper anatomical position. All right, and we need directional terms for the human body because just like being able to navigate through a city or to go somewhere outside of your city, you need directions and you need to have some set reference point in which to start your directions from. Okay, so it's just kind of like rights and left, north, west, east, and south, and stuff like that. We do have some different names for the body though. All right, we do still have right and left. That's not used super commonly because there can be a little bit of confusion about that. But again, as long as you're discussing in reference to anatomical position, that usually helps avoid a lot of confusion. All right, next we'll do superior and inferior. So superior refers to something that is above another structure. Inferior refers to something that is below another structure. And so one important thing to think about here with directional terms is you really need some sort of base reference point. So you need a starting point, just like you would with using GPS navigation on your phone. So for example, a proper use of the word superior could be something like saying the sternum, which would be located right about here, is going to be superior to the stomach, which is going to be down here in the abdominal region. Conversely, we could say like the foot. Actually, no, I don't want to do that one. That's a different set of terms. So we could say, let's do the collarbones are going to be inferior to the head. All right, so you always need that base point. So when you're talking about these terms, you need some sort of starting point in which to reference that. Now, superior and inferior are primarily used for the axial portion of the body. We'll talk more about that in lab, but that axial portion of the body is going to include the thoracic, abdominal, and head areas of the body. So basically just head, neck, and then the torso, which is what this is more commonly referred to as, I think, this entire region. It does not usually refer to something having to do with the arms or legs. Those are part of the appendicular body. And we'll talk more about axial and appendicular when we get to the skeletal system in a couple of weeks. But I want to kind of introduce those right now because we really don't use superior and inferior to reference things on the arms and legs. And there's a reason for that. And that's because what if your arm is raised up above your head rather than down by your side? So that can change that reference and add confusion to how to determine where things are in relation to other things. So superior and inferior are really not used for the arms and legs. For the arms and legs, we have a unique set of terms. Those are proximal and distal. So proximal means that the structure you're talking about is closer to the attachment to the axial body. And then distal refers to something that is further away from that attachment point to the axial body. So if we're talking about the arm here, we could say that the wrist is distal to the elbow. All right, so it is further away from the attachment point to the rest of the body than the elbow is. If we're talking about the leg, we could say that the knee is proximal to the ankle because it is closer to that attachment point on the body. All right, so superior and inferior are used for the head, neck, and torso, and then proximal and distal are used for the arms and legs. Next, let's talk about medial and lateral. So medial means that something is closer to the midline, so the middle of the body. So if we were to draw a line straight down the middle of the body, dividing it into left and right pieces, then that would be more medial. And then lateral is going to be further away from that midline of the body. All right, so if we're in our correct anatomical position here, and let's say we're looking at the hand, so I could say that the thumb is lateral to the pinky. So the thumb is further away from the middle of the body than the pinky finger is. All right. All right, next let's do anterior and posterior, and then ventral and dorsal. Those terms are pretty interchangeable. There are a lot of things, though, where you're going to see exclusive use of anterior and posterior or ventral and dorsal. For the way this class is structured, we don't really see ventral and dorsal pop up until much later in the semester when we do the nervous system, specifically the spinal cord and the nerve roots coming out of the spinal cord. So we won't really see ventral and dorsal a whole lot until that point in the semester for lab specifically. Much more commonly, we will see anterior and posterior, but again, anterior and ventral mean the same thing, and then posterior and dorsal mean the same thing. So anterior is something that is closer to the front side of the body, so the face side of the body, and posterior or dorsal refers to something that is more towards the back of the body. All right, and this can be in reference to a lot of different things. So we could say something like the sternum is anterior to the spine. All right, and then a couple more terms here, cranial and caudal. These are more terms that we don't really see a whole lot in this particular class. You may see them later on in your education and your career, so we do want to cover them so you at least have that information stored somewhere in your brain when you get to that point, but we don't use them a ton in this particular class. But this is in reference to basically, again, just kind of that axial portion of the body, so the head, neck, and torso. Cranial is something closer to the head, and caudal is something closer to the tail, or buttocks in the case of humans who do not have a tail. These are commonly used in veterinary medicine a lot more because of how those animals are set up, and they do have more cranial and caudal sides. And that brings us to planes of the body. So we have 3 planes that we very commonly see in anatomy. So a lot of sagittal cuts in many of our models, and then sometimes we see the frontal or coronal cut, and then the transverse cut. All right, so we'll talk about the sagittal plane first. That is this one right here. So a sagittal cut, the sagittal plane, is going to divide the body into left and right pieces. Okay, so sagittal creates a left and a right piece of the body. And so there's a couple kind of subparts to this. So if you see the word mid-sagittal, that refers to a sagittal plane cut perfectly down dead center of the body, creating equal left and right halves. All right, so that's just the mid-sagittal. It is being cut on the sagittal plane down the midline, the middle of the body. All right, any other sagittal cuts are not necessarily going to create perfectly equal and mirror images of left and right halves of the body. So this cut could be in a lot of different locations and still create a left and right piece of the body. Next, we'll talk about the frontal or coronal plane. Either of those terms is acceptable, so you can see that one right here. This is going to create anterior and posterior portions of the body. So if we were to cut the body in the frontal plane, we would create an anterior or front half and a posterior or back half of the body. And again, this could be a perfect right down the middle as close to the middle as you could get doing a cut like this, or it can be anywhere within there. And then last but not least, the transverse plane. You can see right here, this is going to create superior and inferior portions of the body. So it will create a top and a bottom portion. If we were to cut in the transverse plane, we would get an upper and a lower portion of the body to divide those up. All right, so just a review, sagittal plane is going to create left and right sections of the body. The frontal or coronal plane will create anterior and posterior, or front and back portions of the body. And then the transverse plane is going to create superior or upper and inferior or lower portions of the body. All right, so this section of a brain, so we've got some different cuts here, and so you can kind of see if we do a frontal cut, this is how the brain looks. We can see the cerebral cortex up here and our central white matter and some ventricles in here. We'll talk more about this in lab at the end of the semester when we do the brain, but this is what that frontal plane cut is going to look like. Down here we have the sagittal, again creating left and right portions. This was a mid-sagittal cut, splitting the brain perfectly in half right down the middle. And so we will see this particular image, a sagittal view of the brain, a lot at the end of the semester when we're learning the brain. And then if we did the transverse cut, then we get a slightly different view. We can see a lot of the ventricles in here. Ventricles are open spaces within the brain that have cerebrospinal fluid. And again, the transverse cut is making a top and a bottom, or superior and inferior portion. All right, so that just kind of gives you a little bit of a visualization of how these different planes are really, really useful, because different cuts are going to give us different views of these various structures, and all of these views can be very, very useful. All right, body cavities. So the dorsal or posterior body cavity. This is a very small body cavity. It is going to include the sub-pieces of the cranial cavity and the spinal cavity. Cranial cavity is going to hold the brain. The spinal cavity is going to have the spinal cord. That's all there is to the dorsal or posterior body cavity. Everything else in the body is going to be considered within the ventral or anterior body cavity. And again, I should have mentioned this earlier, these terms are in reference to just the axial portion of the body, so this is excluding the arms and legs. All right, so the ventral or anterior body cavity is going to include the subcavities of the thoracic and abdominopelvic cavity. The thoracic cavity is further broken down into the pleural and pericardial cavities. The pleural cavity is going to hold the lungs, and the pericardial cavity is going to hold the heart. So that's all there is to the thoracic cavity. The diaphragm is going to be our dividing point between thoracic and abdominopelvic. The abdominopelvic cavity could be further subdivided into the abdominal cavity and the pelvic cavity. They're frequently combined into just the abdominopelvic cavity though. And this is going to hold all of the digestive, reproductive, and urinary organs. So this is kind of a graphic showing how those are broken up. So our dorsal body cavity or posterior body cavity again has the cranial cavity with the brain, and the spinal cavity with the spinal cord or vertebral cavity. And then our ventral or anterior body cavity is going to have that thoracic and abdominopelvic cavities. Those are indicated separately here, but they are collectively referred to as the abdominopelvic cavity. Again, that diaphragm, a flat muscle that we'll talk more about in lab, is going to be right here between the thoracic and abdominopelvic cavity. And then again, within the thoracic cavity, we have the pleural cavity shown here in purple that's going to have the lungs, and then the pericardial cavity that is going to house the heart. All right. So those are all of our body cavities. And then let's talk about regions and quadrants of the peritoneal cavity. So the peritoneal cavity is within the abdominal cavity. It is going to house all of the digestive organs specifically. And so we have both abdominal regions and abdominal quadrants. All right, so depending on what specialty you end up in and different doctors' preferences, these can be used interchangeably sometimes, but there are specific situations where you would need to use just the quadrants or the regions, all right? And so if you're just kind of getting like a general idea of where somebody's maybe having pain, then you could use a quadrant to kind of help direct your attention to a specific region, and then you can get a little bit more specific with the actual regions. So our abdominal quadrants are just right and left, and then upper or lower. So we've got a right upper quadrant, a left upper quadrant, and then a right and left lower quadrant. Okay, so we can see the liver, gallbladder are in the right upper quadrant. The stomach is primarily in the left upper quadrant, along with the spleen, which you can just barely see peeking out back here. Different parts of the intestines are found in different areas. One important thing to note is that the appendix is going to be right down here, so it would be in the right lower quadrant. So if you had somebody come in with pain that they're saying is in that right lower quadrant, you should definitely be thinking potentially something's wrong with the appendix. That's not always going to be the case, but that should be where your brain kind of first goes is, oh, there could be something wrong with the appendix if they're indicating pain in that right lower quadrant. And then our regions are broken up a little bit more. So we have the right hypochondriac region, which is going to include part of the liver, but not much more than that. The epigastric region has most of the liver in it and part of the stomach, as well as the gallbladder. The left hypochondriac region is going to include just that tiny piece of liver, as well as the spleen and part of the stomach. And then running down the middle here, we have the right lumbar region, which, as you can see, includes primarily large intestine, a lot of the ascending colon here. The umbilical region is going to be located right around the belly button, and this is going to be a lot of this transverse colon and some of the small intestine. The left lumbar region is going to have a little bit more of both large and small intestine. And then we've got the right and left iliac regions. Again, that appendix is going to be down in this area, so if you're thinking appendix, it could be in the right lower quadrant or the right iliac region. So different people are going to have pain in slightly different areas, so you do kind of want to be aware of both of these. And then we have the hypogastric region, so below. So epi means above, gastric refers to stomach, so this is kind of above most of the stomach. And then the hypogastric, hypo is low, gastric again is stomach, so this is below that stomach region. And then we've got the left iliac region here. All right, and then serous membranes. These are found specifically within the ventral or anterior body cavity. Serous membranes are going to surround the organs found within this body cavity and kind of help enclose them in their own special little area or room, I guess you could think of it that way, that keeps them separate from other tissues and organs within this body cavity. So the serous membrane have three components to them. They have two layers, the parietal and visceral layers. So the parietal layer is going to be what lines the walls of the body cavity itself, so kind of more external. And then the visceral layer is going to be directly on the surface of whatever organ it's surrounding. And then the cavity is a space in between the parietal and visceral layers filled with serous fluid. This is just extra fluid that's mostly there for cushioning. All right, and so we have 3 serous cavities found within this ventral body cavity. We have the pleural cavity again. This is going to surround the lungs. So having this serous membrane with that serous fluid in between these 2 layers helps add some extra cushioning around the lungs, because they are going to move around a little bit within the body as you're going about your daily life, and they're definitely going to move in the case of some sort of traumatic event like a car crash. And so having that little extra cushioning from that fluid can be really, really beneficial. Same idea with the pericardial cavity. This is going to, again, surround the heart. So again, we want a little bit of cushioning for the heart. These are obviously protected by our ribs and sternum. So we've got that hard bone, but we want to give them a little bit of padding. So again, in the case of something like a car crash, they're not just getting thrown up against that hard bone. We have that little bit of cushion for them. And then last but not least, we have the peritoneal cavity or peritoneum. This is going to surround a lot of the organs in the abdominopelvic cavity, like the stomach and intestines. So this is kind of what a serous membrane would look like. Think of it kind of like a balloon. So again, that parietal pericardial layer is going to be the external layer. The visceral is going to lay right along the surface of whatever organ it's surrounding, and then we've got the actual cavity space in between filled with that serous fluid, and so you can see how it kind of represents a slightly deflated balloon. All right, so you end up with those 2 different layers and a space in between, again for a little bit extra cushioning. And that wraps up the anatomical terminology portion.